Thank you, Dr. VGM. At the onset, I would like to thank Professor Duseja and the entire INASL team for inviting me to this beautiful city of Kochi and in the beautiful environment here. So I've been asked to talk about HCC tumor microenvironment. So before I go into whether it bears outcome into treatment, I would first like to tell about, especially to our postgraduates, what is tumor microenvironment. So first let us understand how does any cancer develops. So cancer starts with a mutated or a malignant cell which starts multiplying continuously. So if the question is the cancer just a collection of that malignant cells? So answer is that it also builds a microenvironment around itself so that the cancer cells and the entire tumor can survive and thrive in it. So this microenvironment is known as the tumor microenvironment. So what does this tumor microenvironment contain? So if we analyze the entire tumor through high technological process, we would see that tumor microenvironment will not only contain the tumor cells, it will contain lots of immune cells, NK cells, T cells, B cells, DC, macrophage, and it will also contain lots of support staff, which constitutes fibroblast, endothelial cells, and pericytes, and all the vascular structures, adipocytes. And there is a continuous crosstalk between the tumor cells and all these tumor microenvironment components. So let us first talk about the stromal cells. So what are the functions of the stromal cells? So the basic function is that they will promote tumor progression. So they would consist of endothelial cells which forms the vascular network, and that would supply lots of, that would give the nutrition to the tumor, so that will supply the blood. Then there would be another pericyte which will stabilize the vascular network, and then fibroblasts which would give the extracellular components and growth factors and cytokines are produced by these extracellular components. So extracellular matrix also contains collagen, fibronectin, elastin, laminin. All these are supporting the tumor itself. And coming to the other component of tumor microenvironment, that is immune cells. So what are the functions of immune cells? So many immune cells are trying to fight the tumor cells because immune cells have been trained to fight any invading cells, including the tumor cells. But many immune cells are here in the cancer are actually helping the tumor cells, and they are doing the opposite job. So these immune cells which are actually helping the cancers are like Tregs, M2 macrophages, TGF-beta, IL-10, PD-1. All these are actually helping the cancers to further grow and progress. So basically, tumor microenvironment is a safe house of criminals, their accomplices, and corrupt police officers. So which are trying to help the cancer to grow and thrive, and so this is a good analogy for this. So what does tumor microenvironment? It adds one more dimension of heterogeneity. So what is heterogeneity? So there is interpatient heterogeneity. For example, a similar tumor in two different people would be heterogeneous. It will be different, although the size is same, although the location is same, but it would be different. So this is called interpatient heterogeneity. And then there is, even in the single patient, there are different kinds of heterogeneity. For example, one is spatial heterogeneity. For example, a tumor which starts in the colon or when it goes to the lung as metastasis, it will be different. And then there will be temporal heterogeneities. For example, a lung cancer which starts here, and then once we have given some therapy, then again some of the cells, malignant cells, escape, and then they form the tumor. So the after some time, after the first line of chemotherapy, the tumor, which is now different, and after second line and third line, the tumor would have a different set of mutations and entire microenvironment. And then now to this heterogeneity, we have added a heterogeneity which is due to tumor microenvironment. So what does it mean? That certain tumors are differed topographically. For example, some tumors are considered as hot tumors because they contain lots of immune cells. Some tumors are cold tumors which have very few immune cells, and some tumors are called as excluded, where the immune cells lie only in the periphery. Now coming back to hepatocellular carcinoma, tumor microenvironment here. So here again, the important players of the tumor microenvironment in HCC are cancer-associated fibroblasts, tumor-associated macrophages, other immune cells, extracellular matrix. And let us see how all these act. So what are cancer-associated fibroblasts? So cancer-associated fibroblasts actually lead to tumor aggressiveness, and they actually they are fibroblasts which have become activated to produce all these cytokines and growth factors which are helping the growth of the tumor. So can we actually target these cancer-associated fibroblasts? So recently in 2023, there have been many papers which have looked at whether we can target these cancer-associated fibroblasts and to treatment. And there have been many studies which are going on, still in the preclinical phase, but maybe in the next 10 to 15 years, some of these will translate into clinical trials where there would be drugs which will target these fibroblasts, so that apart from having drugs which are targeting the tumors themselves, we would also having the support staff, that is fibroblasts, that is being targeted here. Coming to the other one is called as tumor-associated macrophages. So what are tumor-associated macrophages? These are blood-derived monocytes which once reach the tumor, they are recruited by the tumor. So most of them are become pro-inflammatory and they try to kill the tumor. But there are certain macrophages which actually do not kill and they become immunosuppressive. So these are called as M2 types of macrophages. So there are the M1 type which are pro-inflammatory, they would lead to lots of inflammation in the tumor, and then there are other type, that is M2 type, which are immunosuppressive, and these would lead to inhibition of lymphocytes, and these also lead to resistance to therapies. So why does an honest policeman, which is M1 type of macrophages, become corrupt and start promoting these tumors? So there are many ways, but mainly it is due to the kind of metabolism which is happening. For example, this is honest policeman or M1 macrophages, and when it is subjected to various kinds of metabolism, like oxidative metabolism, glutamine and all these, it becomes a corrupt policeman, that is M2, and which is promoting the tumor. But can we reverse it? Yes, there are ways and means which we can again target and make it honest again. So the kind of metabolism the macrophages are subjected to make them either good or bad for the tumor. So can we target these tumor-associated metabolism? There are again many studies which are going on, but still all of them are in the lab stage or preclinical stage, and they would see the light of the clinical trial and then maybe therapeutics within next 10 years or so. Coming to other immune cells now. So what are these immune cells? So immune cells are like Tregs and tumor-associated macrophages, tumor-associated neutrophils, and all these immune cells express immune checkpoints like PD-L1 and CTL4, PD. So all these checkpoints are trying to inhibit the immune reaction. So targeting immune cells using these immune checkpoint inhibitors is now actually a reality, and we are giving these treatment. They have been there for a while now, about last 5 years. So this is a modality of treatment which is actually focusing on tumor microenvironment, and it is giving us benefit. So these are now currently the first line treatment option, not only in HCC but many different cancers across the body, and many new emerging drug combinations are also arriving. What about the extracellular matrix? It is also very rigid, and extracellular matrix actually progresses as the disease progresses. So in a normal liver, the extracellular matrix is very simple, but in a chronic liver disease patients, there is lots of fibrosis and lots of collagen and all these activated stellate cells and all that come. And once the patient reaches the stage of hepatocellular carcinoma, this matrix becomes too complex. And what does this complex matrix do? It leads to lots of immune evasion. It promotes the cancer cells because of rigidity and contractility. And all this leads to promotion of the malignant cells. So this leads to lots of immune cell trap, and there's therapy diffusion barrier. That means the therapy whichever we are, chemotherapy which are giving is not reaching the cancer cells, and there's also hypoxic environment due to very rigid extracellular matrix. So there are now drugs which target these extracellular matrix, and some of them are commonly available, but still they have not made a dent into the therapy. But these would be a kind of adjuvant therapy in maybe next 10 to 5 years. So apart from the immunotherapy which we are giving, if we add these drugs after these trials come up, then they would give some more additional benefit. So the take-home points for tumor microenvironment: the concept of tumor microenvironment and its role in the cancer progression and therapeutics has been explored only in last 10 years. So tumor microenvironment basically is a safe house for cancer where it survives and thrives. Both immune cells and stromal cells are important players, and they have a nexus with the cancer cells to promote these cells to grow. And immune checkpoint inhibitors is the first therapy which actually targets these tumor microenvironment cells, especially the immune cells, and are now the first line treatment option in most cancers. But targeting other components of tumor microenvironment is actively being explored and will soon see a reality. Thank you for your patient hearing.